Hello, everyone. Welcome to Voices for Virginia's Children. What's in the Governor Northam's budget breakdown? I'm Allison. I'm the Policy and Program Director at Voices for Virginia's Children. Joining us for this presentation are my colleagues, Chlo'e Edwards. She is our Policy Analyst for Health, Wealth, and Justice. Emily Griffey, our Chief Policy Officer, and Kristin Lennox, our Advocacy and Engagement Manager. And we know it's Friday afternoon, so feel free to keep your cameras off, but we would invite you to introduce yourself in the chat, maybe tell us your name, the organization that you're with, and why you're joining us today. So a little bit about Voices for Virginia's Children. We are, if you go to the next slide, we are a nonprofit organization committed to improving and protecting the lives of Virginia's children. Our policy areas are focused in 4 areas that you'll hear about today. We focus on child welfare, health, welfare and justice, early childhood, and then we also have an umbrella of trauma-informed care, as well as economic security. So today we'll be digging deep into those subjects and talking to you about what was released in Governor Northam's proposed budget. I'm going to now pass the mic to Kristin Lennox.
Thank you, Allison. And we'll provide this information at the end again after you hear the budget breakdown today, but we wanted to just remind you of ways that you can connect with me as the Advocacy and Engagement Manager. I've got my email there, but other ways to engage is through our advocacy trainings, community events, or even scheduling a one-on-one with me. And I'll place some links for some resources in the chat for everybody. Centering equity and just futures and equitable and just opportunities for young people. So what we do know is that policy decisions in the past keep some children and families from the full help and support afforded to other families. These prior decisions have created historic trauma and have built unequal systems. Our policy priorities today must provide opportunities for all children to grow and thrive.
And this is Emily here. I'm gonna give some context for our policy presentation today from Governor Northam's budget. The first thing that is kind of looming over us is the work at the federal level in Congress and the need to pass the Build Back Better Act. You may have seen some news articles today that legislation is being stalled in Congress right now and likely won't move until the first of the year. It includes a number of additional resources that would help Virginia children and families. And so we will be watching it simultaneously with the work at the state level. If you haven't taken action already, just send a note to Congress to pass Build Back Better. We do hope that it won't lose any of the wins in its sales and that it will keep going in January. In particular of note, the 15th of the month, Wednesday, was the last date for the monthly child tax credit payments for families. And those will not continue unless Build Back Better passes in the new year. So we will be watching both things simultaneously and try to keep our eye on Washington, D.C., as well as what's happening at the Capitol and Richmond. Next slide. So turning things over to the Virginia General Assembly and the work that begins there on January 12th. Governor Northam, as his role of Virginia, cannot succeed himself, can only serve 1 4-year term. And so in his role as an outgoing governor, he creates the budget framework for the next 2 years of Virginia, and he is fortunate to be going out of his administration with this historic $13 billion surplus in funding, part of which came about because we underestimated the amount of funds that would be available for programs. We didn't spend as much as we expected to during the pandemic, and then we received additional federal funding in response during the pandemic. So what do we do with a $13 billion increase? Really, we hope that there will be additional funding to continue the work that the Northam administration has done to transform our child welfare systems, our early education systems, improve behavioral health, and continue those progress so that those efforts do not end on when Governor Youngkin comes in on January 15th. We also want to make sure that we are well aware that the systems that all of these efforts are based in human services and education, don't work without people, and that we need to invest in our resources, particularly our public sector workforce, to ensure that there are folks there who are ready, willing, and able, and feel well rewarded and compensated to meet the call. And then finally, with the budget surplus, there will be a specific look at tax credits, tax rebates for families, and what that means. For us, what that means is that those policy choices have to be centered on equity, have to look at improving the lives of the most economically disadvantaged children and families, children of color throughout our state. And we will be looking at analyzing those tax policy choices and working with partners to make sure that we all have as much information as possible about what these choices mean in terms of their impact on equity and opportunity for kids. So one thing that you might have heard of, and we'll be working with our partners at the Commonwealth Institute and the Center for Tax Fairness to provide more information and more analysis of these different tax proposals, but wanted to give you a quick side-by-side of what you may be hearing from the Northam budget and the Youngkin campaign. The Northam proposal eliminates the state's portion of the grocery tax, which is 1.5%. The Youngkin campaign promise was to eliminate that full tax, which included an optional 1% at the local level. He also proposed to pause the gas tax for 1 year. That would reduce gas by 5 cents a gallon. They both proposed a 1-year tax relief payment, tax refund for families of slightly different amounts. And then Governor Northam went further to propose a state portion of the Earned Income Tax Credit, the EITC, that would be refundable and paid directly to families. And that EITC is specifically designated for low-income working families, so would have many specific components to work with economically disadvantaged families. And so then one thing that we wanted to start at the jump here of our presentation in terms of our overall picture of looking at the budget, we have this surplus, we have some opportunities to make some real progress around economic stability for families, but where we're falling short at this point and meeting this moment is addressing children's mental health needs and the national emergency in children's mental health. The budget right now only adds a small amount of funding dedicated specifically to children's mental health initiatives by increasing the Virginia Mental Health Access Project. That's a great program. It really integrates our healthcare settings and our mental health settings and provides more training to the primary care docs and other folks who identify mental health needs and have some consultation to support their patients and clients around their mental health needs. This will expand that training to ER docs as well. That when we're experiencing a national emergency, when we've seen the scale of increased trauma and increased mental health needs, this is inadequate to really provide the full funding. We need integration, not but just between healthcare and mental health, the education and mental health, family support and mental health, all the different pieces. So what we want to make sure is looked at in the future are those initiatives that can link schools and mental health services. We call those in particular providing the clinical services in schools, the tier 2 and tier 3 supports based on the multi-tier intervention model, as well as more opportunities to pull down Medicaid to better support mental health services, more dedicated youth substance abuse recovery efforts, and then opportunities for stakeholders, including young people themselves, to help design these services and what is the most impactful for them moving forward. So we'll come talk more about mental health in the end, but just really want to make sure that from the beginning, we don't miss this opportunity to really invest in children's mental health needs and ensure that their specific issues are addressed in our system. And I'm going to kick things over to Allison to talk more about child welfare.
Thanks, Emily. So as far as the priorities that Governor Northam put into the governor's budget, the first one is a child welfare social worker salary increase. Now, this is part of that 10% that you may have heard about. That is a 10% increase for all state employees that will impact local departments of social services, because it also includes those pass-through dollars. This is really important because we know that we have a really high turnover rate for our workers in Virginia. And we also know that the number of workers that a child in foster care has is reflective often of how long they are in foster care and how many placements they have. So this is a step in the right direction of looking at that workforce infrastructure issue. Another really big thing that probably everyone who has anything to do with child welfare knows about is a system called OASIS. It is the child welfare data collection system that is extremely old and outdated. They put in $22 million to replace this system. So that's really great news. The other piece of that that's not listed here is there is a couple of $1 million to upgrade the fiber optic networks that give some localities high-speed internet. There are some localities who actually don't have access to that broadband connection. So all of that will help support the data collection over time. The next item that is in the governor's budget is around the Family First Prevention Services Act. There's $9 million to fund positions that will help with the monitoring and evaluation of evidence-based services in Virginia. What we had hoped to see is additional dollars really added to scale up those services, but instead this is really looking at the fidelity of the program. So we are hoping to go into the next legislative session asking for a budget amendment for those additional dollars. There is $1 million that's been appropriated to state and local relief funds for trauma-informed care networks, commonly referred to as TIC-INs. So that's really great. We're excited about that continued momentum into that funding pool. And then the last thing is we are really excited because last July, the Office of Children Ombudsman was started in Virginia, and they have already received a ton of cases just in the few months that they have been open. And so we're going to be able to add 2 additional positions to that office, making it 6.5 positions for the new 2 positions, or $400,000 that are going to be in the budget. So that's the things that are in child welfare. And I did just want to always add that Voices is home to the Foster Care Policy Network. It's a great network of folks who come together to create a unified policy agenda for foster care and child welfare as a whole. And we always welcome new folks to join us in that work. Next slide. And so the other focus area that Voices does some of its work in is family economic security. There are several proposals that were in Governor Northam's budget that will help address some of the family economic security issues. One of the great things is it proposes to eliminate barriers to eligibility, one of them being around childcare. So if you're trying to get on that child care subsidy list and you don't have a job, it would at least cover you while you're looking for a job. This is really important because and able to look for a job properly, sometimes you need childcare to do that. That also has a lot to do with the child welfare system. It eliminates the 72-month wait time limit for childcare, and it eliminates the co-payments for Medicaid and FAMAS and reductions for childcare assistance, all really great things that will benefit families. There are also some proposals to improve the benefit navigation. One we're really excited to see in the governor's budget was the refugee, and I don't want to get the acronym incorrect, LEP, Family Benefit Navigator, but this will be really helpful because it's really out of that Office of New Americans that Navigator program is in. Then that will be really helpful. And then there's the Thriving Families Care Coordination. I'm trying to pull up my notes here so to make sure I say exactly correct for that one. I don't have we're still kind of in the process of figuring out exactly what those coordination pilot is going to be. So look for more information from us to figure out exactly what that's going to be in the governor's budget, and then funds to build out an e-referral system. And then the next one around family economic security is the Virginia Agriculture Food Assistance Program. This continues the Virginia Ag Assistant that was established to expand the capacity of Virginia's food providers to accept, store, and distribute food products. This will be $11 million in the first year. And then there are also additional funds for utility assistance, rental assistance, and multi-language SNAP outreach campaign. One of the highlights of that being there will be a income benefit program that will help with utility assistance payments, which will really help out a lot of families in Virginia. Next slide. I think I'm passing the mic over to Emily.
Yep, we're on early education now. And so Allison did highlight some of the issues that are the intersection of early education and access to childcare earlier on her slide, with some of those continuations of the expanded child care assistance eligibility. So we are hoping that those will continue into the new year with some of the additional federal funds and some of the flexibility that the department has right now. Of note, what hasn't seemed to be included at this stage is the higher income limit for child care eligibility. The department may have some flexibility to implement those in the future, but as we know right now, the higher income limits will end at the end of this month, since they're not proposed in this budget language to continue. Although, as I mentioned, there's some flexibility that they have to continue that. The other piece of childcare is that the budget proposes an additional $72 million in federal funding to keep access to affordable childcare. There could be even more funding for that if Build Back Better passes. So just another opportunity to make sure that we work towards that legislation, and also expands our public preschool programs, are otherwise known as the Virginia Preschool Initiative. Under the Northam administration, they've done a lot to consolidate early childhood childcare and education and provide more flexibility and a more robust support system to the Virginia Preschool Initiative. Jenna Conway, who came on board during the Northam administration, would continue at DOE in these roles around leadership on early childhood education, even into the next administration. And so they proposed several initiatives that will expand the preschool program to serve more 3-year-olds, to increase the cost to be more on par with K-12 education costs, to add in more public-private partnerships and in early childhood education, including those community partners, those private preschool providers as a part of that preschool system, and to look at how the future marijuana revenue that was dedicated to early childhood can be used to build up the system. The next area in early childhood is improving quality and accountability. The key issue that we want to highlight is a continued expansion of the early educator incentive grant that has helped to reduce turnover in private early childhood programs. And the state proposes increasing that by $5 million a year, as well as some other additional quality improvement, observation, and accountability efforts at the Department of Education. Next slide, going to highlight a few other education initiatives of the department. We probably heard the proposal to also increase teacher salaries by 10% so that we can be on par with the national average of teacher salaries, or even better than that. There is a significant funding increase to support physical plant changes, capital improvements to schools through the School Improvement and Modernization Fund at $500 million. Some of that surplus that we talked about in the beginning being sent to meet these needs. Additional support to administer a school climate survey, where we get answers to questions around how students feel in terms of their safety, security, and emotional well-being at school. Additional training around social emotional curriculum, and a new $10 million one-time fund to create community schools, and wraparound programs in schools. So we will be watching those initiatives and advocating with others like the Fund Our Schools Coalition in support of these efforts, as well as the continued work around equitable school funding, the at-risk add-on, and those support positions in schools. Next, we switch things over to Chloe to talk about our health and wellness.
Hello, everyone. Chlo'e Edwards with Voices. So a few things going on in here. We have some very intersectional issues or just things around connecting people to systems. And so that requires care coordination and navigation, because we recognize and we've heard that it's difficult to navigate systems from individuals that we serve. So there's this integrated e-referral system. Funding is provided out of appropriation, and it actually follows up on CARES Act funding from an initiative that came out of the Unite Us Virginia. And the purpose of the system is to connect government agencies, healthcare providers, community-based partners, et cetera, to public health services. So there's $8 million allotted for the first year and another $8 million allotted for the second year to help continue to empower members of our community. And if you look at the actual platform, patients complete different steps. Step 1 is entry, step 2 is screening, step 3 is referral, step 4 is the resolution, and then step 5 is feedback. And so it does offer quite guidance for individuals looking to navigate systems. The other is that if we don't have the right workforce, right, in order to meet the needs of people where they are in order to sustain our systems, then we know our systems inadvertently will not work. And so we were pleased to see specifically for our health care systems funds that allows Virginia to draw down on federal dollars for a student loan repayment program, and the federal funding would allow a 1-to-1 match. It'll allow Virginia Department of Health a total of $1.5 million in federal funds, $2.2 million in the first year and $2.2 million in the second year in order to provide workforce incentives. Continuing off of our work for probably over, I'm going to say the past 2 years around maternal infant mortality, is again looking at intersectional ways to help combat some of those maternal infant mortality disparities. So for example, March of Dimes reported in 2016 to 2018 that the infant mortality rate for Black infants in Virginia was 9.5 per 1,000 live births as compared to white infants, and 4.8 per 1,000 births is the rate that white infants were at a rate. So we realized that it's disparate. Black women are 2.5 times more often to die than white women during childbirth. And so how do we help continue to combat some of these statistics? So we're pleased to see funding to a lot of study for human milk banks. It'd be $200,000 for the first year to study the cost efficacy, and this is similar to a theme of we noticed during the pandemic, there was a need for a diaper banks, for example. So really honing in on some of those disparities that were exposed. Additionally, continuing in last session, we had plenty more support for pregnant women recovering from substance use issues through the FAMIS program, for example. But in this governor's budget, we see funding for transitional support for housing for women facing substance use and parenting women at 1.7 million increase. So this will provide permanent supportive housing for pregnant women or parenting women who are facing substance use disorders. Additionally, honing in on, again, these intersectional issues, but also recognizing the root cause of some of the disparities we're witnessing in our systems. For example, when the COVID-19 pandemic started, the Commonwealth of Virginia was using Google Translate in order to help non-English proficient speakers identify their needs, and that was not just nor equitable. And when we look at it from a civil rights perspective, it was a lack of civil rights, which is a lack of justice. So we know that the pandemic, in parallel with inadvertent cultural, racial, historical traumas, et cetera, requires that we connect people to systems so that they can further live long, healthy, successful lives. So we're more pleased to see some funding allocated around language access, We recognize that through our Voices for Virginia's Children State of Children support, 1 in 4 children are immigrants or living in an immigrant family here in Virginia. In addition, 1 in 5 children in Virginia speak languages other than English, including Spanish, Korean, Vietnamese, Chinese, Hindi, and Arabic. So this requires equitable policies that target the unique needs and experiences of children. Funding for language access in the budget provides $7.9 million for the first year and $2.9 million for the second year to state agencies to facilitate and improve language access. I'll tell y'all, ironically, what I heard, one of the few state agencies with a language access plan is the ABC, alcoholic beverage control. And so we definitely have to get our systems more cognizant of language access. Now, there's continued funding allocated for the Office of Diversity, Equity, Inclusion, which we are pleased to see around language access and equity efforts. This would also provide staff positions specifically for the Office of Diversity, Equity, and Inclusion, including a deputy a diversity officer for immigration integration, assistant director for access to functional needs for people with disabilities, and then 2 for American Sign Language interpreters. So this will support the office of the governor through a little over $500,000 in 4 full-time employment positions for the first year, and then it models that for the second year as well. And my colleague Allison mentioned in the Family Economic Security section that out of the Office for New Americans as well, there is a benefit navigator program, because we know that limited English proficient speakers, that is intersectional with greater rates of poverty and access to services. So we are pleased to see that as well. Now, lastly, for Racial Truth and Reconciliation, we were pleased to see our Racial Truth and Reconciliation week included in the programming for just overall when we think of the culture of the Commonwealth and how do we continue to create inclusive communities and spaces. So there is funding in the governor's budget to just support racial reconciliation events and programming. It supersedes our week, but just in general, acknowledging historical events like the arrival of African Americans to Fort Monroe in recognition of the 400th anniversary of slavery. So we're pleased to see that also included in the governor's budget, and hope to see continued support by the administration for our racial truth and reconciliation work as well. So there's some other mental, did you want to do this item?
I'll jump here because there was one thing that I forgot to mention earlier under the mental health initiative. So you don't have to go back, it's okay though. So the other mental health initiatives, are largely in our state around building out stronger systems of mental health. There is a new proposal that will also help address some of our workforce shortages in mental health, and that is proposed by the Virginia Healthcare Foundation to pay for some of those hours towards licensure, the licensed counselors and social workers that need to pay for the supervisory time. That would eliminate some of the barriers to getting to be a licensed counselor or social worker. So we will be supporting that proposal and hope that that will add some more folks into the licensed workforce and can help diversify the field of mental health providers. In addition to that, then the governor's budget does continue to build out some of our mental health system that impacts kids and families across the board around the crisis response system, both the new emergency call center call line that will be implemented nationwide soon, 988, as well as the local Marcus alert system into 5 new localities. The mental health initiatives continue to fund the statewide alternative transportation model that is for children and adults, to have more trauma-informed, less law enforcement officers involved in transportation for those who are under temporary detention. It steps up the services offered through STEP Virginia, those full continuum of services at our public mental health agencies, the Community Services Board, CSBs. And it includes a study of the needs of the mental health system with a dedication of an additional $100 million in the FY24, the second year of the budget, to help meet those needs. So overall, there is some strong progress on mental health. as we continue to build on these systems, but we would like to see more dedicated to children and the integration. I can't, and my brain is done this Friday afternoon, integration of mental health needs and the education system and where children and families live, work, and play. And so I did want to also just make a note here of what's not included in the budget and some of our next steps from this point on. And then before we say thanks, we'll open the floor to any questions. So our next steps from here is that when the General Assembly returns in January, on January 12th, each of the legislators in the House and Senate will have the opportunity to add member amendments to the budget. And so that's when they can add some things that were not included and can enhance items that were included or propose new initiatives. And so this year we will have the Senate Democrats will largely be in charge of shaping the Senate budget, and the House Republicans will largely be in charge of shaping the House budget, which will send many issues into negotiation and compromise between those two houses. Governor Youngkin does get a chance to send down some amendments as well, since you're sort of very new in that role as you come in, as he becomes inaugurated on January 15th. We never anticipate a huge amount of amendments coming from the recently inaugurated governor, but he will have a chance to make a few changes as well. And so then our the members of the House and Senate will continue to meet and negotiate on these items and hopefully reach an agreement by March. We'll also be watching, as I mentioned in the beginning, if Build Back Better does move in this time frame, and if there's anything that needs to be included in this budget to comply with the issues around Build Back Better as well. So Chloe and Allison and I and Kristin, along with many of our other partners at the organization, will be working with our coalition and members of our networks to make sure that we have any additional items that were not included in the budget proposed for support here. I've listed a few things around the broader mental health initiatives, the expanding access for health insurance to immigrant children, a part of the Healthcare for All Virginians Coalition, any additional work to reduce mental health disparities, including building our community-based programs or expanding our home visiting efforts, and more efforts to promote food access and nutrition access in the coming year. And so I think if folks are interested in typing in a question in the chat or coming off mute, if there's anything that you had a question about that you wanted some more clarification, we may have, since this is a quick turnaround from the budget being introduced yesterday, there may be a few things that we still need to hear from our partners and get more detail on, but would be happy to find out and provide you with some more information. So if there are folks that have any questions, please feel free to put it in the chat or come off mute. And then we'll put on our next slide where you can reach us to follow up with email. But Kristin, I know you put some more in the chat if you wanted to remind folks about those advocacy opportunities.
Yes, sure thing, Emily. So I put the links in there again. And if we start to get a lot of questions, and I'll put them again before we close the training, this webinar out. But an invitation to register for any upcoming advocacy trainings. That's that first link, our events link. Also under that link, but there's a separate Eventbrite I shared here, is our MLK Day rally, Rallying Towards the Future, Living Dr. King's Dreams. This will really launch our Advocacy Day with our youth cohort, which is on Tuesday the 18th. But this will be a moment to get together, engage in some healing-centered practices centering around our policy priorities through our Racial Truth and Reconciliation campaign. We also have a link here to schedule one-on-one advocacy prep meetings with me. That's a link to my Calendly, and those are for meetings in January, just before session. And then I also included our advocacy guide. You can find it on our website, but here it is for quick access.
And so go ahead.
I was just going to say before we close, we also have our policy network. So Allison mentioned her child welfare and foster care network, but I also have our health, wealth, and justice network if folks would like to join that. And then Emily, you also have your early childhood education network. Additionally, we also have the Racial Truth Coalition. So you can always use this contact information to get in touch with any of our networks, coalitions, or committees.
Awesome. Well, thank you, Taylor, for your note about saying thanks. We are happy to bring this information and help folks better understand how kids are playing out in this budget. And it really takes all of us. It's going to take the voices of youth in the youth advocacy cohort, you all as advocates, other professionals and advocates in the space to make sure that these initiatives, plus everything that was not included in the budget, are on the table, are front and center of legislators' minds during the legislative session. We want to make sure that kids have a strong position moving forward, that there are more equitable opportunities for kids. And so you're raising your voices, contacting your legislator, attending future budget hearings and advocacy days will all make that possible. I will note that there is budget hearings, scheduled for January 5th. We haven't shared that information yet because there's still no sign up or detail on where or how those will take place. So when we do, we'll pass that along. I know that that's a great opportunity to talk to legislators if you have some time that day. And our General Assembly session will largely take place in person this year down in Richmond. But as folks have become more comfortable with the Zoom world and online meetings, your legislators certainly might be willing and able and interested to have a Zoom meeting with you rather than a face-to-face or travel to Richmond. And there probably will be opportunities with different advocacy days to participate in both Zoom meetings and in person. Other opportunities, we know we'll have the MLK Day rally on the 17th, a mental health advocacy day on the 19th, some work with Families Forward, doing some virtual parent town halls during the legislative session that we'll send a link to you, and there's more opportunities to sign up there. So stay tuned, stay plugged in, open our emails on Friday when we send you some details about what's happening at the Capitol. Pass those on to other people and encourage them to sign up, and keep being a voice for children and participating in all of our advocacy together too. So thank you all for your time today.